Namaste, Mrs. Samira. We have your lab result back.
What is it, doctor? My symptoms are persistent. Should I be worried?
You don't have to worry about it. You have been diagnosed with hyperthyroidism, secondary to grave disease. The symptoms you are experiencing are due to thyrotoxicosis.
What is thyrotoxicosis, hyperthyroidism, and Graves' disease, doctor?
Hyperthyroidism is a form of thyrotoxicosis due to inappropriately high synthesis and secretion of thyroid hormone by thyroid gland. Similarly, thyrotoxicosis is a clinical state that results from inappropriately high thyroid hormone action in tissue, generally due to inappropriately high tissue thyroid hormone level.
Is it cancer, doctor?
No, it's not cancer, it's an autoimmune disorder. Graves' disease is an autoimmune disorder characterized by the production of antibodies against multiple thyroid protein, most common thyroid stimulating immunoglobulins against TSH receptor. It is multifactorial disease which is affected by genetic and environmental factors. Now regarding genetic factor, like all autoimmune disease, it occurs commonly in patients with positive family history, more common in monozygotic twins than in dizygotic twins. Genetic alteration can also lead to Graves' disease by different mechanisms. Environmental factors include stress, smoking, infection, postpartum, iodine, and highly active antiretroviral therapy. Its pathogenic mechanism develops as thyroid-stimulating immunoglobulins binds to TSH receptor, which mimics its action and stimulates adrenyl cyclase and increase the release of thyroid hormones, which activate negative feedback mechanism, leading to decreased production of thyroid-stimulating hormone and thyrotropin-releasing hormone. Likewise, autoimmunity, which leads to development of infiltrative ophthalmopathy due to cross-reactivity of antigen, causing protrusion of eyeball, that is exophthalmos, and is associated with increased volume of retroorbital connective tissue and extraocular muscle, and that is due to inflammation with edema and swelling of extraocular muscle. Accumulation of extracellular matrix, which is mediated by activated CD4 plus helper T cell that secrete cytokine that stimulate fibroblast proliferation and synthesis of extracellular matrix protein, and mark infiltration of retroorbital space by mononuclear cell.
Is it life-threatening? Are there any complications with this disease, doctor?
No, it is not life-threatening, but there are few associated complications with this disease, such as thyroid enlargement, which is also known as goiter, sympathetic overactivity like atrial flutter, fibrillations, stroke, cardiac failure, corneal injury as a result of persisting ophthalmopathy despite successful treatment of hyperthyroidism, infiltrative dermopathy, which is also known as pretibial mixed edema. Other complications include thyroid myopathy, osteoporosis, and pregnancy-related complications like preeclampsia, miscarriage, premature labor, low birth weight.
These complications are easily manageable by the medication I have prescribed you, but you make sure you have them on time, follow all the dietary modification provided by us.
So, doctor,
That will be all for today, Mrs. Samira. We'll see you again next month for follow-up. Take care.
okay, doctor, I'll be here for my follow-up. Thank you, doctors.
Okay, Dr. Godatta, being a pathology resident, what pathological finding do you expect in a patient with grave disease?
Sir, in pathological findings, we look at the gross and microscopic features. On gross features, we see thyroid gland symmetrically enlarged due to diffuse hypertrophy and hyperplasia of thyroid follicular cells. On a cross section, the parenchyma has soft, meaty appearance resembling muscles. A normal histology of thyroid gland, we see follicles of various sizes containing colloid. The follicular cells are cuboidal cells with round nucleus. On the histology of Graves' disease, we see follicles have a pseudopapillary architecture with infoldings of hyperplastic follicular cells. There is scalloping of colloid correlating with the resorption by the follicular cells. Also, lymphoid infiltrate consisting predominantly T cells along with scattered B cells are seen.